shy on the front?
My Uncle Charlie in the Navy in World War II.
Is it time?
All those folks, is he still with us? He was sick today.
Really? Charles,
Hey.
I'm inviting you to the front row, because, you know, you're Charles.
I don't know if that's a good or bad thing.
Pay attention this time, Charles.
Yeah, there's going to be a quiz. All right, let's just check in. What's up? Any pharmacy refusals? Yay. Cool. There's no news on my,
What do you mean pharmacy refusal?
yeah, did anybody go to the pharmacy and get turned away? Did you have to go to 3 pharmacies? Did you have
I
to do the
couldn't get
pharmacy
mine
call?
at Towns and they wouldn't renew my, Xanaflex.
Oh, okay. Is that because you have another muscle relaxer, or?
You put me on Soma,
Okay.
so,
Cool. All right. We'll sort it out.
okay.
Everybody, this is Ann. Ann, this is everybody.
Hello, everybody.
So we got, I think, 30 people scheduled today, so I can't talk very long because I got to start seeing everybody. Everybody, this is Vanessa.
Hi.
Vanessa, everybody. Because there's so many of you, we need more of her. So we just hired Vanessa, so she's going to be one of our front office receptionists and chipping in like everybody else is around here. So, Ann, you got something to say? Is now the time?
Maybe other people have something to say, I don't know. This is a work in progress, as most of you know. We started this at the end of March in an attempt to take care of the clinic and at the same time take care of all of y'all. I'd like to know, how's it going from your perspective?
Great.
That's worked out
That's the
great.
best way to do anything like that.
Yeah, I think it's
It's
new.
more personal and you get more time with doctors and, discussing some of the issues that you
Good.
Are there any questions other than mine? No questions.
I want to acknowledge something. I was skeptical about this. I said no when we wanted to do this. I thought this would be a place for the DEA to focus on me some more. Are you kidding me? You're bringing all these people together? You know, Bob Gardepy was concerned about 2 trucks in the parking lot at Osco. Now we're bringing all these felons together to exchange meds. Are you kidding? So no transactions, please. But you know what it's turned out to be is a surprise to me. I mean, I got to tell you, 5 weeks ago or 4 weeks ago, we saw 65 patients in one day. Like, that's impossible. I need Hermione's time turner in order to do that. I don't know how we did that. But I notice a difference in my own attitude. Okay, I notice a difference in me. And part of what I've been doing is I've been allowing myself to be a victim. Has anybody noticed me whining a little bit? So, and part of it is I designed myself, you know, to be heroic. I went to medical school. I want to help people. I want people to get better. I mean, if you have blood in your chest, I want to put the chest tube in and drain it out. You know, I want to do that stuff and make an impact, but I want to do it like within about 5 minutes, because that's my attention span. So I've been noticing myself kind of feeling like I can't do this. I'm having this conversation, kind of similar to what people in pain have. You know, it's like I can't do this. Yeah, I am different. I'm back. And what I've decided is what's helping me with that is that in this context, we're taking care of pain. I'm not worried about blood in your chest or a pneumonia or all the other things that I consider upstairs. The other thing that happens to me upstairs, I noticed this yesterday, I saw several pain patients yesterday, and upstairs, I had this thought or this experience like, okay, there's more people in the waiting room, and I gotta get going, and there's more people in the waiting room, there's the easy button, and I have to like push it. And down here, it's like, we got 3 hours to do our thing, and I'm moving fast, because I just do, but I noticed that with a couple of patients, I saw something completely different that I had missed. And I picked up something down here in the context of, okay, we're talking about pain. So, like this conversation of adhesive arachnoiditis, or people who have like really bad pain that persists after they've had steroid injections. You know, it's supposed to be like 2.7% of the population, but you know, like 98% of the population isn't here, so maybe a lot of you guys have it. So the pardon the interruptions, but we're going to get vital signs done while we go. So, Greg, take notes. So I think that, you know, this pain thing is not only mysterious for you guys, it's mysterious for me. It's like, I'm used to like sore throat, penicillin, out of here, or car wreck, ambulance, chest tube, IVs, ICU, OR, or morgue. You know, I mean, things are like decided quickly in my medical history, and I've never been afraid of pain. I've always said to my patients, if you have pain, I got more medicine than you have pain. You know, and that one time that didn't work out. I was in Wolf Point, and it was 35 degrees below zero, and a truck full of Native Americans rolled, and one guy ended up in the snowbank, and he was in the snowbank for hours. He got dragged in, and his hands were white, and he was frostbitten, but he was intoxicated, so it was like maybe he had a head injury. So we had to ship him to. Nobody would take him. No helicopters would fly. So here we are in Wolf Point. There's no CAT scanner in Wolf Point. The CAT scanner is in Poplar. So we had to put him on an ambulance and go over and get a CAT scan. His CAT scan was normal. He comes back, and his hands started to wake up. And his alcohol level went down, and he started to be in agony, and we used all the morphine in the county. And finally that guy got thrown to Salt Lake for his frostbite. But usually I promise, I've got more medicine than you've got pain. And I can't promise, I haven't promised that to you guys. Because I don't. And not only do I not have it, but the system doesn't have it. It's just like it's gone away. And so I've had to come up with a new way of being, you know. And when I started this clinic, I said, I'll stand by you until your problem's resolved, because it's an urgent care. And now I can't even say that. Like, I don't know where I'll be. So it's like, I don't know if I'll have a license and all that kind of uncertainty. So that's been making me really anxious and really pissy. So this thing is giving me some relief in terms of, okay, this is a problem that nobody else has taken on. I love doing problems that no one else has taken on. I love creating stuff. I love kind of being the MacGyver medicine person, and I can't let the chronic nature, come on, Waylon, there's plenty of chairs. I can't let the chronic nature of stuff, you know, drag me down. I've never been interested in diabetes. You know, well, come back and we'll see what your A1C is. And you know, I've never been interested in treating hypertension. It's like, okay, let somebody else who's OCD do that. But what's happening here is that this is a problem that's become more chronic. I mean, initially it was urgent. You know, if you come in and your doctor's dropped you and you don't have any pain medicines and you're going to withdraw, that's urgent. Okay, I'm wired for that. I'm wired for urgent. Now it's like, okay, we've handled that, but you know, I want to kick the can down the road, and who's there? There's nobody there. So this is something we've got to do together. So what I see is that my nature is to not want to attend to things long term, and to move on to the next challenge. Okay, and so maybe that's why I've been so whiny and negative and victim. So it's like I cannot stand victim mentality, and here I am being a whiny little wuss about Mike Fanning, and he called me names. He called me narcissist. Like, well, yeah. So I kind of see that we're in this thing, and we're in this pain conversation, and it's us, right? And it's not like, well, I'm going to say something narcissistic. If I was Sullenberger, and I was in the cockpit, and you were the passengers, I wouldn't be saying much. I'd be busy looking for a river to land the plane in. Okay, but even that guy, he didn't waste a lot of time in conversation. He said 3 things to the people. He said brace for impact. It was pretty fucking obvious what was going on. Silent plane, coasting, river. Yeah. So, and I'm not necessarily Sullenberger in this kind of situation. I feel like getting up and running down the aisle saying, "We're gonna crash!" But, it's not happening. We're not crashing. And the bad news is the cavalry's not coming. I know. The good news, no, nothing. I'll tell you that in a second. But the bad, gotta finish my joke. The bad news is the cavalry's not coming. The good news is we're not surrounded by Indians. The cavalry's coming is a construct from Lone Ranger days, right? It's like, we've got to make this for ourselves. And I say ourselves because the reason I can empathize with people in pain is because I've had pain. I ruptured my Achilles tendon 3 weeks before the dog sled race about 6 years ago. And it's like I had a lot of time and money and dog food invested in this race. And I couldn't walk. But it's okay, you're on a dog sled, you don't have to walk. So I found a ski boot to put my foot in. But a front entry ski boot I couldn't get my foot out of because I can't pull it because I don't have my Achilles tendon. So I found a rear entry ski boot, like one of those ones from 1980s. Okay, back pain. Sit in a chair. And so I put my leg in a ski boot and I did the race. And it hurt. And every time my leg would cramp, it would the muscle would shorten, and there's no tendon holding it, so there's no way to stretch it. So it was like it hurt. But the funny thing is, that was my best finish because I wasn't getting off running, pressuring the dogs. I just let the dogs do what they were trained to do. I had to let go of something, and there's something to let go of in this whole thing. I'm letting go of my career. I'm letting go of my, is this business going to work? This whole thing is in order to rescue our business also. So you guys are, I'm kind of in a victim, and I'm asking you to rescue me. You guys have been in a victim position, and you're asking me to rescue you, and I'm saying to you that there's either you can either be a victim or a rescuer, or a perpetrator in life.
Or an advocate.
Yeah, or what?
Advocate.
Yeah, well, that's right here. Exactly. And that's what we're aiming for. Victim, no power. Rescuer depends on a victim. And then we recognize this. If you act like a rescuer, pretty soon you're going to be seen as a perpetrator, because whoever you rescue needs a perpetrator to keep them in the rescue position, and you're in the victim position. So we're gonna like aim for this middle spot. And like, it's going to seem sometimes to you like I'm your perpetrator. I'm saying, well, let's go down, or let's find out something else, and let's, you don't need this stuff, you need to go to this stuff, and I don't want to do that, okay? I'm finding, did I talk to you guys about the alignment effect? If you come up with something, and you present it to me, it's about 80%, 80% reliable versus the placebo effect, which is 30%. So, you come to me with a plan, like Waylon, you came to me with a plan. It's like, I don't think that's going to kill you, let's do that. And if you have a plan, then you've got more power of it. Come on up, Liz. We're going to pass the hat real soon, so I want all the chairs full. So if I just give you a water pill, there's a 30% chance it'll work. If I'm giving you a placebo for your pain pill, you're going to know that like within a couple of hours, right? But if you come up with your own plan, it's 80% reliable. So much more effective. So I'm interested in empowerment. I'm interested in you having some power over this. And we're all kind of in this lifeboat. So that's my story about victim status. Anybody here felt like a victim? Has anybody here seen me whining? You know, I've been negative, and I've been letting this get me. I'm sick of that. I'm just like fed up to here with it. And so, as far as Mike Fanning and the board goes, I haven't heard. And that's their mentality. They know at some fundamental level that I want an answer. And they also know at some fundamental level that I make decisions in somewhere between 90 seconds and 5 minutes. And that 2 years has been agony, and if they could make it 4, they would.
I don't think they have an answer that's gonna hurt you, and that's why they're quiet.
That's the thing, I dealt with them a lot, and if they had a definitive answer, they'd be all over you because they'd be happy to help you.
My narcissism is incredibly dangerous to the entire society. Anyway, so I don't know where that's going. In fact, I'm beginning to realize that without Mike Fanning, we're not here. He created this. Sure. You know, he's given us the input to go, okay, we can't go that way. We gotta go this way. Nobody's doing this in the country. So we're inventing it, and we need your feedback to how to invent it and make it work. But it's invented to help save the business and help do something that's being called for, because there's just, well, it's uncalled for what's happening, you know, the whole conversation around pain. And so when we get some more power, we get to express ourselves about it, and then we get to tell the rest of society that, hey, come on, this pain thing is buried under this addiction conversation. And okay, there's people who are addicts. I'm addicted to ice cream. You know? And so it's like making people wrong for being an addict is like, how can you transform that? How can I make, if you got pneumonia and I blame you, or you smoke, and there's doctors who fire their patients for smoking. You're smoking, you're not worthy, get out of here. Like, how are you going to get my wisdom about smoking if you're not with me? You know? Yeah, go ahead.
How can they consider alcoholism disease but not cigarettes?
Because it's not illegal.
Which is bullshit.
Yes.
Okay.
Yeah.
Okay. I just wanted to check that out.
The disease model for alcoholism, I'm glad you brought that up, is the model that works.
Charles? Because they say...
My bad. Should have left you back there. I was wrong. Forgive me. Yeah.
Don't they pay SSI now for drunks?
No.
I had heard that they did.
No.
No?
No.
Okay.
Used to.
Oh, they did used to? Okay, I
Now-
thought I heard it somewhere.
For addiction.
For a disease.
So drunk would be a pejorative term.
Yes.
Who hasn't been drunk in this room? I figured.
I haven't been drunk in almost a decade, I'll give you that.
So alcohol, here's why an addiction like alcohol is so awful. It works. Initially, it works. You know, I remember I was 13. I could not ask a girl to dance. You know, my buddies and I go out behind the gym. We drink the Annie Apple Springs or whatever that stuff is, and then I go back in and I ask the girl to dance, and all of a sudden I'm John Travolta. So it worked, you know, and it's like, but later on it doesn't work. So it's like, is alcohol a gateway drug to something else? You know, is marijuana a gateway to heroin? Well, then kissing is a gateway to AIDS, you know? It's like everything in the world is going to expose us to substances that we may become addicted to. And addiction is a human condition. We're addicts. We were born pre-wired with this phone number. 1-800-WHAM. We know how to go wham. You know, your babies go wham. And then you got to figure out, it's one of 5 things. Who's been mom? Okay. Okay, got it. Okay, so if you've been a mom and a parent, and you got babies sitting there whining and crying, you got 5 things to do. You're going to change their diaper, you're going to try to feed them, you're going to make them warmer, you're going to make them cooler, and you're going to get them their nap. And it's like, and then you got to guess. it's just guesswork. It's like I don't know how moms do it, because you don't get feedback about how well you're doing.
Until they're about 18 years old.
Right, and then it's like, fuck you, I'm out of here, mom. Well, I did my job.
Yeah.
You know?
Got them out of the house, but they're coming back and there's more of them.
I know. And then you get grandkids, and that's so great, because you can spoil them and ruin them and give them back to their parents, and like, hope they're the child that you were, so you can suffer and get the karmic impact. Yeah, so it's like, it's cruel.
It is.
It's cruel.
My parents are doing that.
They're doing it to you?
Yeah. They're still living, they don't know the word no, but I remember they knew the word no real well growing up.
Mm-hmm.
They don't know it now.
I know.
That's all the chocolate they can eat.
I don't know if getting even is cool or not. It's, you know, it's kind of funny. I'm sure they thought that their parents were cruel when you
I know.
came along.
I know when I was a kid, what was that? Save the switch, spoil the child.
Mm-hmm. Long time controversy, isn't it?
Yep.
That's a controversy around belief, and the good news about beliefs is you can have them, and nobody's going to change them. And I've given up talking about politics, except for right now. You know this controversy about the Medicaid expansion, and I started accepting Medicaid patients last June because I thought Medicaid expansion was going to happen. So, and I thought it would be like really lame if I waited for Medicaid expansion to actually pass and then I jumped on that bandwagon. I thought it would reveal me as a narcissist or something, yeah. Somebody just interested in money. Come on in, have a seat.
Oh, lawyer's there?
Yeah, I'll go.
Here, wait, have a seat. I can't sit long enough.
So there's all this political argument about this, and you know, I have an opinion, and I have a lot of them, and so I was sharing my opinion with a representative, and then he didn't like what I was saying, and he sent something back, and I sent something back, and then I sent an email. This is like 1 a.m. Probably shouldn't have sent it. Asshole.
Nothing ever happens to that.
Oh, an asshole. And he forwarded that to all the leadership in the Montana Medical Association, so I've been banished. So, it's like I really realized that engaging in a controversy about beliefs just gets you more arguments and more. And this whole pain thing is about beliefs. It's not about evidence. It's about how people believe. There are certain agencies that believe a certain way, and then certain other agencies that believe another way, and there's this tug of war. And the only way beliefs change are slowly and gradually based on civil disobedience. I told somebody the other day, because of this pain conversation, we have now formed a bona fide pain clinic. And I realized that, no, this is a renegade pain clinic. So, that's what I've got to say so far. And you had something you really wanted to communicate.
Thanks for working with us. There are just a lot of moving pieces, and we're making it up. And really appreciate feedback. Really appreciate people being great with our staff. And the people that I would want to have a different conversation with aren't here. But I just want to thank you for being great with the staff as we figure this out. Figure out how to provide something that is obviously wanted and needed. And if you've got questions or comments or whatever, I pretty much take every phone call. If I don't, I'm really great about calling back. So.
Particularly the difficult phone calls.
Yeah.
Like they were, you know, the receptionist was rude to me, or the pharmacist messed with me, or that kind of stuff. We wanna get all those and document them.
Yeah. Well, yesterday, conversations that I'm having. Someone's parent is in the hospital because they attempted suicide. Someone was having a conversation about their experience of being shot at in Iraq. someone else is dealing with their mother coming in and out of ICU and just on death's bed, and dealing with figuring out how to manage work and grandkids, and that parent now being transferred to Billings. Well, and those are conversations I'm having with people on my staff.
That's the staff.
That's the staff. These are the people who are doing their level best to be of service. And I know that every single person sitting here is dealing with what you're dealing with. So is my staff. So here we are, you know, and doing our
Make sure you let them know.
yeah, please let them know.
I've watched quite a few people be rude to Amanda. Just straight.
I have to.
Yeah.
And it's not right.
It's not right.
She doesn't get paid to deal with that.
Yeah, thank you. Well, she's upstairs, she can let her know.
I will.
So, and what that lets me into is the fact that the reason we can empathize with you, the reason we're having this conversation is that we're in pain. And pain is, runs in a lot of different ways. And everybody's in pain, we're just not lying about it. We just decided that we're not going to lie about our discomfort. We're not going to lie about what works and what doesn't work. The tendency is to be snarky with the staff and then great with me because I'm the guy that writes the scripts. Well, I invite you to be snarky with me, okay? Because I'm trained for it. And particularly,
I'm trained for it. I'm really great.
and I'm not
If you're
criticizing
having
anybody.
a tough time and you just need somebody to listen, and if you want to swim around and be a victim about something, I'm the one.
Yeah.
And I promise I'll be great with you.
This seems more like a family to me, a family atmosphere, you know?
Yeah.
Like people you can talk to.
Yeah, and it's fucking dysfunctional.
But we put the fun in dysfunction.
There's only two kinds of families: dysfunctional and those who are pretending not to be.
Yeah.
That functional family doesn't exist. Well, maybe on occasions, but that's why we hate holidays, because we're all pretending to be functional, and then some explosion happens. Yeah, right. And but I'm glad you said that, because I'm going to erase this line through victim. Because you can't get to power unless you acknowledge that you're a victim. That's why I said to you, I am so sorry that I've been such a snarky little victim the last couple of months, because I'm like sick of all this stuff, and I'm like, that's the Al-Anon salute, by the way. All you guys who I want to invite to Al-Anon, that's the salute. It's like the only way to power is to acknowledge your powerlessness. Okay, we're powerless over these things. And the access to power is to claim it. Like I'm gonna be more powerful about this. And where does power come from? It comes from being responsible. It comes from saying, I could have done that differently. I could be a little bit less of a narcissist and a little bit more caring, okay? And instead of just acting like I care, I could actually just do that, So it's like I get that every once in a while. And what makes people look crazy and irritable is terrorism. We talk about this a lot. Pain is a fucking terrorist. Look what terrorism's done to our society in 13 years. For 4 months, we were a happy family. And then we decided to go attack some country that had nothing to do with that, and then, we've had an impact on it for the last 14 years, and it affected us as a society entirely. And then we've been attacking each other ever since, politically and emotionally and financially, like trillions of dollars, right? And it's like, if we let that terrorism affect us, then our families dissolve, the pain owns us instead of us owning our lives. And that's the kind of stuff I've been talking about. But it starts with, I feel shitty today. You're okay to say that. Most of us are lying all day long. I'm fine. But the thing about pain is it has you lie all day long about how much pain you're in. And then no place where you can really be yourself and tell the truth. The problem about telling the truth is that you tell the truth all the time, like, I feel like shit, okay? And people don't want to talk to you. People aren't interested in your feeling like shit. People actually feel like feeling like shit is a contagion and they're gonna catch it. Anybody got divorced here? Do you realize that getting divorced is like, it's contagious? Like your friends don't hang out with you anymore because they're afraid to catch it?
Oh, yeah.
Yeah.
Friends you grew up with.
Yeah.
That you've helped out in your lifetime, and when
Yeah.
you ask them for help, they kick you to the curb.
They kick you to the curb. I love that. The curb. Now, when people kick me to the curb, God damn it, I'm mad. And then I realize, wait a second, I must have had some expectation. Like I gave you the best years of my life, and now you're being a jerk. It's like, if we actually get rid of expectations, then the curb, well, the thing about the curb is it's a little bit higher than the gutter. I don't know, it's like we expect people to take care of us like we've taken care of them. And people aren't going to do that. Particularly your kids.
That's a fact.
But that's what you designed them to be independent. You want them to fly off. If you threw them out of the nest and they didn't fly, they go splat. So our job is to teach them to be independent. And if we don't teach them, life does, and there you go. And that's what life's teaching us about this whole pain thing. There's some lesson in here. I don't know what it is. I'm looking for it. I'm digging for it. I want a lesson for what my pain has to offer me so that I can put it the fuck in my rearview mirror. Like, I got other shit I want to get done. Anybody here keep lists about things to do? If you're in pain, what are the first 9 things you got to do today? Take care of my pain. You don't get much shit done when you're in pain because you've got this list. And all 9 of the first 10 things on your list is take care of my pain, get my meds. Take 45 minutes to get showered. Like that. So let's do something about an engagement about how to not all be victims. Okay. Something I said to Ann last night. Like, okay, we're in a lifeboat. Okay, and the Titanic is sinking. They hear the freezing people screaming. We're going back. Some agonizing point of that movie, wasn't it? You hear people dying, and there's all this fear because if we go back, they'll tip over our lifeboat and we'll be in the water. And it's like us and them. Well, consider that it's us. And this boat's pretty full, but like, this is a big issue. This isn't about my license or the DEA being up my ass or other agencies or pharmacies turning us down. And like, how could they? Well, we're going to sort that out, I promise you. But it's like, if we start taking this on as something that we're responsible for, like each other, okay, and I'm here to help. Like, wow, how are you today? Like, what is up with that prior authorization? And did your rheumatologist give you good news or bad news? And if it was good news, great. If it was bad news, I'm sorry. And like, what's next? And we're going to look for alternatives because the conventional stuff didn't work.
for surgery at 7 in the morning.
7 in the morning?
Good luck.
Does it? So a conventional solution, maybe. Okay? And if we don't, if you go from the standpoint of, okay, I'm going to get this thing, I'm going to try this because I'm in agony. I'm going to try this. Well, what do you have to lose? And like, if you're still in agony after your surgery, you don't have to blame the surgeon. You could just say, okay, well, that didn't work. Let's try something else. And we're gonna keep going.
That's just one thing I checked off my list.
Yeah.
That's the big
That's
thing.
number 10.
Well, yeah.
The first 9 you gotta handle. After hours of discussing with your pharmacy about prior authorization of something that we prescribed in December, we finally, it's like, it is nuts, how big this is. So, but if I keep going on, like, we'll never get out of here. So let's get me going so I can see you guys and get you through. But I just want to acknowledge you for being here. I want to acknowledge that it's a 3-hour deal. Now, people tell me that it's a 3-hour wait upstairs anyway on days when we see 65 patients. It's a 4-hour wait. I got that little time turner from Hermione, I borrowed that, you know. And so what I promise is I'll be prompt and get you all through. The ones I don't know as well, I may take a little more time with, or see you at another time, so we can get to know each other better. The folks that I've been seeing for over a year, it's like crank through, okay? And it seems like, I just wanna apologize, because it would seem like, God, it would be easy just to see me and get me out of here, you know, like, it's like getting my gas, this is like the gas lines in the 1970s, you know, you gotta wait. But I think it's worth it. I mean, I think it's worth it for us all to get that we're not alone. Pain makes you feel like you're alone, and you're not. Yes?
Okay, I was born and raised in Utah, and I bounced around from different states. And up in Indianapolis, you know, anyway, Washington. All the doctors I've ever seen still seem to give a shit. You're the only one I've ever met that cares. Actually cares.
I used to practice in Tooele.
Did you?
Yeah. So I cared when I was there. So it's like, it's hard to keep caring. You know, I had to regenerate that, because I was like, I don't give a shit.
Yeah.
You know, I hope all this pain takes go away, it's nothing but a pain in the ass, and it's not my pain. I've had that conversation from time to time, it's like, what am I doing? But I'm not about really the pain, I'm about the power. I'm about like, okay, I've been in pain and I've figured out ways to get over it, and I've been suffering, and I'm dramatic and victim-y, and you know, I've been married 4 times, you know, like that's a problem. Like, you know, there's some sort of blind spot that everybody's got, that's mine. So I'm willing to learn, and if I'm willing to learn, I'm gonna learn from you guys. I want to learn about your pain and how it is. I also want to learn about new techniques. I learned about medical marijuana by listening to people who already had cards. And that's why it's like, it seems miraculous to me. Because guess what? My medical marijuana patients, they're not here for their card. Talk about empowerment. I don't ever see them. I love that. That's why I'm constantly going, oh yeah, go MJ, go. No, oh, that reminds me. There's this conversation that we tend to have. I call it bitching to brag. We complain about our circumstances because aren't we awesome that we can tolerate them? Oh, my kids are like, whoa. Or my pain is like, you know, there's a tendency for us to compare our pains. Well, my pain's way worse than you. I mean, look at my clavicle. Okay, my pain is really, you know, and I got this enzyme defect that causes me to rapidly metabolize opiates. So, you know, so I got that, and it's like we have a tendency to say, okay, oh, and all those bastards that are lying and selling, it's their fault that we're in this situation. You know, it's not. It's not. I'm here to tell you. All the street meds that flood this place, they're from India, Mexico, Canada. You guys aren't selling them.
You order them on the internet.
If you sold your pain meds, you'd have to buy them back at 3 times the price. So it's like, and if you do sell them, then let them. Then great, more power to you, and they're gonna catch you. So, but I'm not going to catch you. I'm not interested in that. I'm interested in staying out of trouble. But really, there's a difference between legal activity and illegal activity. A car dealer is not responsible for how fast the cars go after they leave the lot.
Not yet. Let the legislators handle it.
Yeah, really. So I'm not saying I'm endorsing anybody diverting their medication. What I'm saying is that that's law enforcement's job. And eventually, we've got to get that thing separated. We've got to get it separated from you know, there's people who are addicted, and then there's people who are in pain, and then there's people who are pseudo-addicted. That means they want more relief. Like when I had a kidney stone and I wasn't getting enough pain medicine, I was digging through my backpack looking for my Percocet because, damn, it hurt. That's pseudo-addiction, right? And so when you're in pain, you'll do anything. Okay? So that's why I'm interested in getting your pain relief, so you don't have to do all that stuff, and you can have a few more things on your to-do list. Any questions about that?
I do.
I'm just begging us all to sort of say, everybody's pain is an individual thing, just like everybody's personality disorder. Okay, mine's narcissism, you all got your own, and it's like, okay, let's include that, and then live our lives. Stop trying to be perfect, just look for some progress. And being scared and terrorized makes you wanna do it perfectly. So just acknowledge it, and then we're gonna fuck up our way through the next 3 hours and get everybody seen, okay? So, that's all I got. Keep talking if you want, I'm gonna start seeing people. Who's first, Tyler? What's your guys?
Mr. John Burke. Come on down. Confetti cannons, flash your mic. See? I'm trying to get
No, I'm not here.